I'd like to welcome everyone to the latest installment of CADCA's Research into Action webinar series. My name is Jacqueline Brogdon. I'm an Evaluation Research Associate here at CADCA. And if you haven't previously attended one of these webinars, the purpose of these is to introduce coalition members and substance misuse preventionists to current and relevant research in the field right now. So I'm joined for this installment by Dr. Samantha Puvanesarajah and Michael Tynan. They're going to be presenting on their article, Youth Indoor and Outdoor Exposure to Secondhand Smoke and Aerosol, which was published in the American Journal of Preventive Medicine in June 2022. They're going to discuss estimates of self-reported public indoor and outdoor secondhand smoke and secondhand aerosol exposures among US youth, using data from the 2020 National Youth Tobacco Survey. They're also going to be covering some of the implications for clean air legislation. So now I'm going to introduce them. So Dr. Samantha Puvanesarajah is an epidemiologist in the epidemiology branch in the Office on Smoking and Health at the CDC. She graduated with a master's in public health in epidemiology from University of Georgia and a PhD in epidemiology from the University of North Carolina, Chapel Hill. Prior to joining the Office on Smoking and Health, she was a postdoctoral fellow at the American Cancer Society. And while there, her research has focused on youth use of commercial tobacco products, secondhand smoke, and secondhand aerosol exposure, and tobacco quit lines. Michael Tynan has been a public health analyst in the Office on Smoking and Health as well, on the policy team, where he works as a subject matter expert on tobacco policy issues, including tobacco prices, tobacco use in popular media, smoke-free policies, and cannabis and tobacco overlap. He previously served as the policy director with the Oregon Public Health Division, where he worked on various public health issues and led the development of public health administrative rules on cannabis after legislation. He holds an MPH from the University of Washington in Seattle. And so now I'm going to turn it over to our presenters to discuss their work.
Hi. Hi, everyone. Good afternoon, or I guess good morning, depending on where you are. I just wanted to say, first of all, thank you for giving us this opportunity to present our research. And to give you an idea of the flow of this presentation, I will begin by going over some of the background on secondhand smoke and secondhand aerosol, and then discuss the methods and findings of our paper. And then Michael will take over to go through some of the policy implications of our work, and we'll then open up the floor for questions. So let's start with some of the basics of secondhand smoke, which you may see abbreviated as SHS in this presentation. Secondhand smoke is the combination of smoke from the burning end of a combustible tobacco product and also the smoke breathed out by a person who smokes. And secondhand smoke contains thousands of chemicals, hundreds of which we know are toxic, and at least 70 we know to cause cancer. And we have countless studies that have shown the harms of secondhand smoke, and the US Surgeon General has concluded that there is no safe level of secondhand smoke exposure. There have been several strategies that have been thrown out there to help reduce secondhand smoke exposure, such as opening windows or separating people who smoke from those who do not. And Michael may touch on this as well, but to paraphrase what's on the slide, the only way to truly eliminate public exposure to secondhand smoke is to eliminate public smoking. So there's good news and bad news when it comes to secondhand smoke exposure trends. The good news is that secondhand smoke exposure is down. This is data from the National Health and Nutrition Examination Survey, or NHANES, and it shows that there have been steady declines in secondhand smoke starting in the late 80s. However, the bad news is that progress in reducing secondhand smoke exposure has stalled since 2011, as you can see in this figure. In fact, in 2014, it was estimated that about 58 million people who don't smoke were still exposed to secondhand smoke. And approximately a third of these people were either children or adolescents. And as our study is among youth, I just wanted to take another slide to emphasize how children and adolescents are especially vulnerable to secondhand smoke exposure. This figure shows data that is a little bit more recent, from 2017 through 2018. And it shows that about a third of children and youth from 3 through 19 years of age had secondhand smoke exposure. However, secondhand smoke is not the only issue that we have to worry about. And as we all know, the landscape of tobacco products is always changing, and e-cigarettes are currently a big issue. Secondhand aerosol from e-cigarettes and heated tobacco products is, first of all, less safe than clean air. It threatens tobacco-free norms, and it also complicates the enforcement of smoke-free policies. So this figure I'm showing here uses data from the National Youth Tobacco Survey, or NYTS, and among youth, self-reported secondhand smoke exposure, which is this top line that's shown in blue, has decreased slightly from 2015 through 2018. And during that same time period, secondhand aerosol exposure, which is the orange line, has slightly increased. And one important point to note about these estimates presented is that they represent both indoor and outdoor exposure together. And that is important to note because that brings us to the study that we will be discussing today, which, as Jacqueline mentioned, was published in the American Journal of Preventive Medicine this year. And our study was the first to present separate estimates of indoor and outdoor secondhand smoke and secondhand aerosol exposure among US youth. And this data gives us a better understanding of where youth are being exposed and could be used to inform policy changes. Most current smoke-free policies are targeted at indoor exposure. However, as you'll see, our results suggest that these policies should be expanded to also cover more outdoor areas. So to better understand tobacco-related issues among youth, the Office on Smoking and Health, which is where Michael and I work, in collaboration with FDA, develops and fields a survey called the National Youth Tobacco Survey, or NYTS. And NYTS is an annual cross-sectional school-based survey of US middle and high school students. And this data is publicly available on CDC's website if anyone is interested in doing their own analyses. NYTS is an excellent resource for studying secondhand smoke and secondhand aerosol exposures among youth, along with other tobacco-related questions, because it is constantly being updated in order to query on the most pressing commercial tobacco issues among youth. In this study, we used data from 2020, which was collected from January through March of 2020. And data collection was truncated due to COVID-19. However, the weighted sample still yielded nationally representative estimates. And also thinking about how the pandemic may have affected our results, this period of data collection, January through March, represented a period before widespread stay-at-home orders were in place. So we thought it was unlikely that the COVID-19 pandemic would have affected the estimates of secondhand smoke or secondhand aerosol exposures that we used in the study. And I just also wanted to note that even though the data collection was truncated early, there are still 14,531 students that participated in the 2020 National Youth Tobacco Survey. So the definitions of the main exposures that we studied in this paper are listed here on the slide. Again, I want to emphasize that 2020 was the first year that NYTS asked about indoor and outdoor exposure separately. And what I show here on the slide are kind of the condensed version, just for space reasons, but to give an example of how the question was worded on the survey. For instance, indoor secondhand smoke was determined by asking students how many days in the past 30 days that they had breathed in the smoke from someone who was smoking tobacco products in an indoor public place. And examples of indoor public places that were given were school buildings, stores, restaurants, and sports arenas. And a similar question was used to determine public outdoor exposure, with examples of these locations being school grounds, parking lots, stadiums, and parks. And students who responded 1 through 30 days were classified as being exposed to the exposure of interest. And students who said that they were exposed 0 days were considered as being unexposed. So going into the study methods, I'm not going to spend too much time on the methods on this slide as it's discussed in detail in the paper, but just to give a brief overview, we calculated weighted prevalence estimates and adjusted prevalence ratios for each of our different exposures. And this is a list of all the covariates used, which you will see on some of the slides coming up. I wanted to note what is included in the current combustible tobacco product use, this line right here. which was, this measure included cigarettes, cigars, hookah, pipe tobacco, and BDs. So I'm now going to go through a selection of some of the results from our paper, and I would highly encourage going back to the paper and taking a look at it if you have a chance, because we do provide a lot of results in the paper, some of which may be useful in your work. And I will be providing, Michael and I will both be providing our email addresses at the end of this presentation. So feel free to reach out to us if you are unable to access the paper online. I'm not sure if it's behind a paywall or not, but we will both be happy to email you the paper. So one of the main findings of our study was that almost 2/3 of US youth, or 18.1 million students, reported exposure to either secondhand smoke or secondhand aerosol. Approximately 16 million students reported exposure to any secondhand smoke, so that's indoor or outdoor, and 12 million students reported exposure to secondhand aerosol exposure, also either indoor or outdoor. And this slide shows the breakdown by indoor or outdoor. So when comparing indoor versus outdoor exposures, it's clear that outdoor exposure, which is represented in green, is more common than indoor exposure, which is represented in the orange. 16 million students reported outdoor exposure to either secondhand smoke or secondhand aerosol versus 13.7 million students who reported indoor exposure to either. And so that's that first two set of bars that's represented there. Moving to the other sets of bars, we see that while there is a noticeable difference in indoor versus outdoor secondhand smoke exposure, which was 37.6% for indoor secondhand smoke versus 53.3% for outdoor secondhand smoke, the prevalence of indoor versus outdoor secondhand aerosol exposure were pretty similar to each other. And Michael will touch on this, but these results show how important it is to having outdoor protections, how important it is for having outdoor protections in place, especially among youth. So that was basically the first part of the analysis that we did. The second part of the analysis that we did, we looked at different predictors for the different types of exposures using the several covariates that I had listed before. And the estimates shown in this table are adjusted prevalence ratios with 95% confidence intervals in the parentheses. Estimates that are in bold are those that are statistically significant. And estimates above 1 show what we could call a positive relationship between a variable and our measure of interest compared to the reference. For example, for sex, all of our secondhand exposures, we see that ratio is above 1. Meaning that females compared to males were more likely to report indoor or outdoor secondhand smoke or secondhand aerosol exposures. On the other hand, when we look down a couple of rows to the race and ethnicity variables, we see that these ratios are below 1 for non-Hispanic Black students, which means that they were less likely to report outdoor secondhand smoke and indoor and outdoor secondhand aerosol compared with non-Hispanic white students. So this is just the second half of the table. I broke it up because it was a very long table. So we also saw some interesting findings when it came to looking at tobacco use. Students who are currently using combustible tobacco products, which are those products I mentioned earlier, were more likely to report exposure to all of the exposure studied compared to students that did not use a combustible tobacco product. And then also looking at the bottom of this table to the household member tobacco use, we see that is a very influential factor when it comes to secondhand exposure, with almost all students within each type of household member tobacco use being more likely to report secondhand exposures. So these results that I presented show us the scope of secondhand smoke and aerosol exposure among youth, split out by indoor and outdoor exposures. We show that both are public health issues, particularly since outdoor exposure is more common among youth. And we also saw some differences in exposure by demographic factors and tobacco product use, which can be used to develop targeted prevention programs. And with that, I'm going to hand it over to Michael, who's going to discuss some of the policy implications of this work.
Great. So Samantha showed you this slide a little bit earlier, and I think this will actually get to one of the questions that someone asked about why did the stagnation. The next couple slides will sort of answer like why we've seen that. And if you think about what was happening on this, go back, Samantha. I don't want to go yet. No, backwards. There we go. So if you think about what's happening, sorry, Samantha's driving the slides, so we might be a little clunky, but it'll work out, I promise. So if you think about what was happening on this slide over time, it looks like in the 1980s, at the very far left of this slide, in the late 80s, early 90s, that almost everybody was exposed to secondhand smoke because we know now from objective data that these are from serum cotinine levels that almost everybody was exposed to secondhand smoke. You could smoke in work sites and restaurants and bars. This is a period before the advent of comprehensive smoke-free laws. And in the early 90s is when primarily communities in California started to adopt what we would now consider today the precursors to the comprehensive smoke-free laws that we see today. And I'll show you what that slide looks like in a second. But over time, throughout the 90s, more and more communities started to adopt them until the early 2000s when we started to see these laws get adopted at a statewide level. And more of the population started to be adopted. As this was happening, more businesses were starting to go smoke-free voluntarily. We were starting to learn more about this. And it was in 2006 when the Surgeon General's report came out when we started to see a tremendous amount of activity. So Samantha, if you'll go to the next slide, please. And we didn't decide to do it today, but we have actually a slide series that walks you through every year from 2000 until today, and you see the smoke-free laws populate. And what ended up happening was around 2006, we started to get smoke-free laws that got adopted primarily on the West Coast and the East Coast at a ballot measure level. Ballot measures started to be adopted by voters, started to approve smoke-free laws, and more people started to get protected by these laws. So these were laws that prohibited smoking in work sites, restaurants, and bars, in all places, at all times indoors. And the gap that we see today continues to primarily exist in the southeastern United States. So this is only statewide laws. If we were to draw in the communities, what you're going to see is in some of these places, like in Kentucky and in Texas, a quarter to a third of the population is protected by local laws. But when we consider state and local laws together, about 66, about two-thirds of the states of the U.S. population lives in a state or community that has a state or local comprehensive smoke-free law. And so that's why we still have about 25% of the population that continues to be exposed to secondhand smoke, because they continue to be exposed to secondhand smoke in either by living in the southeastern United States or through some of the places that are not protected by comprehensive smoke-free, which we'll talk about a little bit more. So Samantha, if you go to the next slide. While we have that good news about the laws that have been adopted and the declines, we do have some bad news, right? We have disparities that continue to exist, and disparities that also continue to exist in some of those states that have comprehensive smoke-free laws. Through Samantha showed you the data on youth. We also know from other in-Hain surveys, like what populations continue to be exposed. And so it's primarily youth, it's primarily African Americans, and it's predominantly people below the poverty level. And this is because of where they continue to be exposed to secondhand smoke. There are gaps in smoke-free laws that we need to close, primarily geographic gaps in the southeastern United States, which you saw. And then with the data that we're showing from our study, that we know that youth are reporting being exposed in outdoor settings. And so a question that also someone has that maybe we can get to in a little more detail during the Q&A was, well, what locations? What are you even talking about? And so we're talking about outdoor public places. And so think about tobacco-free campus policies, right? Like for a college or a school setting, or for a large employer. Americans for Non-Smokers' Rights the Americans for Non-Smokers' Rights Foundation actually has a model law that they've put together that outlines the kinds of places that we're talking about with outdoors. And so it would be if you were, and it was an outdoor workplace, for example, where two or more workers gather, those workers should be protected from secondhand smoke outdoors, just like they're protected indoors. There are semi-outdoor areas like patios and other settings that have a roof over them, right? Where if people are smoking, smoke can still gather and linger. And so so there are a lot of different settings that ANR has identified. There are also settings that are close to entrances or exits or air intakes, and the under the model law that the sort of the partner community has agreed to, it's somewhere between 12 and 15 feet from those settings. So there's a lot of outdoor, semi-outdoor locations that we can talk about for protecting people from secondhand smoke. Let's go to the next slide, Samantha. Another setting is in semi-private places, and so or actually private places. And so smoke-free multi-unit housing. This is not outdoor, this is indoor that we're predominantly talking about, but this can also extend outdoor, and I'll talk about that in a second. Like, this is a setting where someone may have a smoke-free home. They've decided to make their home, their apartment unit, smoke-free, but their neighbors may not have. Right. And we know from a lot of studies that have been done over the last 20 years that secondhand smoke can drift. It can drift through walls, it can drift through ventilation systems, it can drift through through hallways and shared common spaces, and people can be exposed to secondhand smoke in multi-unit housing. And so this is a place where we've made a lot of progress, including through HUD's new policy about prohibiting tobacco use in public assistance housing. But there are some communities in some states that have also made progress in private market rate housing to prohibit smoking or tobacco use indoors. And then that's where, again, tobacco-free campus policies can apply, because something that we know about smoke-free and tobacco-free policies is that they just don't eliminate exposure, right? They change the social norms about the acceptability of smoking, which results in reductions in, and we know this from a whole host of data that's including conclusions that are in the Surgeon General's reports. Communities that have passed smoke-free laws see reductions in adult smoking prevalence, increases in the number of adults who smoke or who quit, and declines in youth initiation. We also see declines in hospitalizations for heart attacks. So there are a lot of population-wide benefits because of these either social norm changes or the lack of exposure to people from known human health hazards. So Samantha, let's go to the next slide. Right, and another space that we have to think about as well is cannabis. So this is a new evolving when we start to think about the different products that people are exposed to. So I live in Oregon, and when I walk my kids to school, cannabis is legal here. And when I walk my children to school, to elementary school, I walk by people smoking cannabis in the park. I've been to Seattle and Denver and Las Vegas and a whole host of communities that have legalized cannabis use, and I get exposed to cannabis in public places all the time. So we need to do a lot of work to quantify what level of risk that exposure is. But there's also opportunities to protect people from secondhand cannabis exposure. And the challenge is that in all of those states that have legalized, public cannabis use is currently illegal. So it's not allowed, but it's happening. And so that's a larger presentation that I actually present on quite a bit, that I'm happy to talk about in more detail. But that's another challenge that states are wrestling with, is how to address cannabis use. Is there a way to, for this product that we've legalized, allow people to use it in a setting that isn't a public setting, but allows them to use a product that in many cases 55% or more of the voters have approved legalizing for a whole host of reasons, including some criminal justice reform reasons. So next slide, Samantha. All right, so I'm not going to read the slide, but you can take a picture of it and tell your boss you stayed until the end. And Samantha, I don't know if you want to close anything out on here, but this is some conclusions about our study. But what I think it's important to know is that we know a lot about secondhand smoke exposure. And what our study allows us to do is quantify the extent that youth are exposed indoors and outdoors, and can help states and communities talk about why gaps need to be closed, based on product type, based on the secondhand smoke and secondhand aerosol. It can be used as evidence to justify the need for those policies, as well as why we're even talking about outdoor in some settings, right? Like, why are we talking about outdoors? Because even with strong smoke-free laws, we still have a large number of youth who are reporting being exposed to these products. There's no safe level of exposure. We've known this for a long time. The only way to prohibit exposure and to protect people is by prohibiting smoking in all indoor areas. We also know that there are opportunities to expand to outdoor areas where youth are reporting to us that they're exposed, and to address all products and product types. And the way to think about this, to make this easy, is those tobacco-free campus policies, right? Like, it's absolutely a best practice to adopt a tobacco-free campus policy in a setting where youth are or young adults are. And so that's what we're talking about really in most settings. And so we can talk about what that looks like in more detail during the Q&A, but Samantha, I don't know if you want to add anything that I sort of glossed over from the study.
No, I think that
Okay.
all sounds great.
Okay, great.
Then we'll hand it back over to Jacqueline for the Q&A.
Hi, well, thank you so much for that presentation. It was super interesting. I know that I learned a lot, and I'm excited to see what, all of our attendees, any questions that they have. So before we get into the CADCA questions, we're going to have some CADCA questions to kind of launch things off, but feel free to put any of your questions into the Q&A box for our presenters, and we will be doing that shortly. Could you go to the next slide?
Oh, sure.
We can go back to that slide at the end, so they can get all your contact information. But our first question is, how can data from research papers such as yours help build the case for those that are advocating for smoke-free air policy? So, how might you suggest using this sort of data?
Yeah, I mean, Samantha, I'd like you to jump in here, but I think it's sort of what I said at the end, right? Like this just justifies the why the heck are we even talking about this? I think that there's a lot of policy fatigue in tobacco prevention in some places. I think it's very easy for decision makers to say, we already addressed that, right? Including in places where they haven't addressed that, right? But they think they've addressed it because they live in a place that's smoke-free and they go to places that are smoke-free and they are not exposed to secondhand smoke. So even in places in the South where, we showed you there were those geographic gaps, they may live in a community that has maybe even not even a comprehensive smoke-free law, but their life is smoke-free because they are privileged enough to go to places where people are not exposed. Their children are privileged enough to go to places where their children are not exposed. They may live in a home that they've decided where people can't smoke. They patronize businesses where people don't smoke, and their reality is not the reality of what their constituents or the people are facing. And so I think that's one place that this data can be useful. Samantha?
Yeah, I totally agree. This data just shows how it's still a huge problem. We saw in our data that 2/3 of students reported exposure to either secondhand smoke or secondhand aerosol, which translates over to millions of students. And data from research papers like this are also helpful because, as I mentioned, the National Youth Tobacco Survey and other similar surveys are constantly updating their questions to be able to get to the most pertinent questions when it comes to understanding exposure. And so we're constantly getting new data. So being able to parse out indoor versus outdoor exposures shows us where the problems are and helps us determine what we should be focusing on in part. And it's just like what Michael said. It's easy to think that since you're living in a place where there are certain protections in place, you just kind of forget that there are still millions of people that are exposed to secondhand smoke, both at their jobs, but also just in a park. So it just highlights the importance of continuing to advocate for these policies.
Right, yeah. And so when we talk about, I think one of the questions was, well, what are the outdoor kinds of places you're talking about? And the example I used a couple times when I was talking were tobacco-free campus policies for schools. But as Samantha just mentioned, another best practice location that I think that have been sort of accepted by the public health community and by sort of decision makers are places where children gather and play, right? So it's places like parks, like city parks and public parks, cities, or even just city property or government property in general. It's not uncommon to see there to be tobacco-free grounds, right, on city property or on county property or in parks or on some beaches. Some beach communities have done this successfully, and it's not always because of protecting public health. Sometimes, or not only because of protecting public health, right? It can also be because of justifications for litter and justifications related to the environment, right, as well. And so, and rather than getting into a horse race about, well, is this one right or is that one right? I would say use whatever argument works, right? Like if it may be that the community, in your community, the environmental justice argument is going to hold more weight, then use that, right? Or both of them can be used for different audiences. Use that. I think they're absolutely both valid and reasons to address outdoor exposure or outdoor tobacco use rather.
Yeah, that kind of leads well into our next question. Some of this might be repetitive, so feel free, to just answer, with whatever additional information you have. But what recommendations do you have for schools who are trying to address outdoor secondhand smoke and exposure that their students may be experiencing on those school grounds?
Yeah, I mean, I think we have to be careful about CDC giving recommendations, right? Because we're not telling, right? Like, so what we can talk about is the science, and what the science tells us, from the paper that Samantha led, right? We know youth are continuing to be exposed, right? And we know that there are, best practice opportunities out there from the partner community to address, smoking on college campuses and smoking on school campuses, right? Like the idea of smoking in school buildings is I mean, I remember having, and maybe I'm aging myself a little bit here, but I remember in high school there was a smoking section for kids that was allowed outdoors, and maybe it's because I was in Kentucky, but in the 90s, but 18-year-olds were allowed to smoke, and so they created a location that is hopefully not happening anymore anywhere. Like that's like we've moved social norm wise away from that. So there are movements out there among the partner community to adopt comprehensive tobacco-free policies now on campuses for at the K through 12 and at the college level. So hopefully this isn't controversial anymore. I'm curious what folks in the audience, if maybe I'm overselling that a little bit about how accepted that is. But the challenges seem to be, do we include e-cigarettes or not? I think that's where the debate has moved to for a lot of people in communities. I don't know, Samantha, do you want to talk about what our paper shows a little bit, or?
Well, unfortunately, we aren't able to split up
Right.
the exposures by where exactly the students were exposed in our paper. But hopefully that is something that we would be able to do in the future, so we could have a better idea of where exactly the exposure is occurring. And I don't know if I have anything else to add to what
Okay.
Michael has said about helping schools address these issues.
But I answered in the answered question that we had earlier that another Michael asked about, what should they ask for? And I put a copy of ANR's model ordinance in there, which addresses outdoor public places and the kinds of places that we're talking about. And so that's what the sort of the public health partner community has sort of rallied around.
Okay, great. And, are there any other resources that you would recommend for coalitions who want to learn more specifically about this topic? Any resources you can kind of steer them to? If you have anything, we can also put that in our follow-up information so they can have links to that and access that. But
yeah, I mean, I think I would coordinate with Americans for Non-Smokers' Rights Foundation. I think they're the lead partner community, the lead partner group that has the most information, including a model law on this. And so, we can make sure that you have a link to that, and they can also provide technical assistance. I think the good news about the tobacco prevention partner community in this space is that this is a place where there's not disagreement, right? Everybody agrees on what we should be doing in this space because the science is clear, right? Like there is no safe level of exposure to secondhand smoke, period. Like that's into discussion, right? Like we know that ventilation and designated areas do not work indoors. And so I think we're in a very good space in this. And so the materials that ANR has on their website, and then some information that CDC has from the 2006 Surgeon General's report, which even though now that's, 16 years old at that point, is that right? Like it's 16 years old at this point. Like that's it's still very valid. Like the conclusions in there are still valid, and there's a lot of information that you can use from that.
Yeah, and I would second what Michael said about the Surgeon General report, because those are very comprehensive and basically go through every single piece of literature that was written about secondhand smoke dangers up until 2006. So that will definitely have a lot of information. Unfortunately, I don't know if there is anything quite as comprehensive when it comes to secondhand aerosol exposure, as that is kind of a newer exposure and we don't know as much about it. But the resources that ANR has are a great starting point.
okay, great. I will make sure that those are linked in our follow-up email so that everyone can, go and access that. And I know we have a lot of Q&As or questions in our Q&A box. So Michael, it seems like you've been reading, able to like find them in there. So I guess I'll just let you kind of steer this Q&A section and answer, however you'd like.
Yeah, I mean, I think we sort of answered. I hope Joy feels like we answered her question, but I think it's with the gaps that remain and policy adoption. So I mean, that was one question. And then the next two are about Samantha. I don't know if you want to talk about this one. Like there's Andrew's question about laws versus no laws and geographic analysis and the limitations that we had with our paper and what we do know.
Do you mind reading out
Yeah,
the question?
did you look at, I'm sorry. Did you look at youth exposure differences between places with and without, essentially with and without smoke-free laws? And is there any other geographical analysis that you can say from the paper?
We did not look at that in this particular paper. What we wanted to do, first of all, was get out these estimates of the indoor versus outdoor exposure first before we started looking in more detail about different things that could be affecting exposure. And so I think that looking at geographic location is definitely a very interesting question, and it is something that is on our radar to better understand. So while it's not in this paper, we hope that we can do something around that in the future.
Great.
And I should also mention, if you are interested in doing that, this data is publicly available. So it is open to anyone to analyze.
Great. And then there's a question from Kyle about, have any measures been taken to estimate the amount of secondhand smoke exposure within vehicles or public transportation among youth? Many parents and guardians smoke or vape while driving. And so, I mean, I would say from the policy side, I think that's been an interesting area where we have seen some states and communities address tobacco use, where they prohibited tobacco use in vehicles with children in them. Different laws look a lot different. Sometimes it's if there's a kid in a car seat or not. I'm not sure why all of a sudden once they're out of the car seat, why it's okay to smoke around them. But there are different levels of policies. I think there are a lot of questions about what does the enforcement look like in that space. I actually am not sure off the top of my head that I know the answer about what estimates exist in these settings. I don't even know if we could even answer that with this survey. Could we, Samantha?
So I need to go back and check. I
Right.
believe that NYTS, National Youth Tobacco Survey, in the past has asked specifically about exposure in
Right.
vehicles. And I think that there was a paper published, but I can go back and check on that. And if I do find it, I will send it to Jacqueline to.
And we'll just make sure to circulate it. Yeah, perfect. Yeah. And then Judith has an interesting question about how many she says how many researchers, and I won't be able to answer that, but I think we could, like, so we'll say, are researchers working on aerosol and connections with COVID-19 and what elements are in that aerosol? I think if there's a COVID-19 question out there, yes, people are working on it, right? I think is the answer to that question. I don't know I don't know that I've seen anything published on this recently, but what I can say is in the policy space, we did definitely see private businesses react to this when there was uncertainty around COVID-19 and how it was being spread in the early time in the pandemic. We've actually seen some policy successes in this too, interestingly. So I think casinos are a location, and we're primarily talking about youth exposure, and youth should not be in casinos. But this is a space where surprisingly, casinos were a place that had been left, not surprisingly, casinos have been a place that have been left behind in comprehensive smoke-free laws over time. So on those maps that we've shown you, it's a mixed bag about whether or not casinos adopted a smoke-free law or not, and even less so among tribal communities. And with COVID-19, after businesses closed during that summer of 2020, or that spring to summer of 2020, and then started to reopen after that closure period, we saw casinos predominantly reopen smoke-free, and most casinos now have at least gone temporarily smoke-free. Every casino in New Jersey for a while was smoke-free, including Atlantic City. The Navajo Nation, as you may know, adopted a law that prohibited all commercial tobacco use on tribal property, including in the casino. And so this has been a surprising success space, and it's been because of COVID-19 was the catalyst for this. And so it's not really what we're talking about, but it's an interesting sort of byproduct that happened, a silver lining from that. So I didn't really directly answer your question, but I answered in the way that I could. because I don't think we're able to talk about what COVID-19 research is out there because we're not COVID-19 researchers. So David has a question. Let's see. How advocates for tobacco-free outdoor spaces if oftentimes youth are exposed by family members, with banning outdoor smoking potentially ostracize youth from their family. Okay, so one of the things that we know is when comprehensive smoke-free laws are adopted in a community, we see an increase in smoke-free homes in that community. And so what that means is that when people's community goes smoke-free, they also make their home smoke-free voluntarily, right? And the gaps that we have are the challenges when we have someone who makes their home smoke-free, but they live in a multi-unit housing, right? And so I think those are where I think the policy successes are. Would banning outdoor smoking potentially ostracize youth from their family? I'm not sure I know the answer to that, Samantha. I mean, it's an interesting question, but I don't know that we know the answer to that. I don't know if you want to.
Yeah, it's definitely an
about
interesting
that.
question. I don't know if we can speak to the last part, but as we showed in our paper, we did see that students who came from households with tobacco use among, I think, almost all of the exposure or different exposure groups within household tobacco use showed that they were more likely to have exposure to secondhand smoke. And so it is definitely an issue, but unfortunately, I don't know how much, as Michael said, if there's not much that we can do within the household, especially with multi-unit housing.
Right, and then Joy has a question about casinos that I'm not sure I'm able to answer here. So we're not trying to ignore your question. I just don't know that we have an answer to it. Let's see. Can you recommend a source for model ordinances for smoke-free public places? In New York State, marijuana is allowed to be smoked by those over 21 in public, right? So, I think that's a place where for model ordinances for smoke-free public places, I would go to the ANR, Americans for Non-Smokers' Rights model policy that Jacqueline's going to share. I think the challenge with cannabis use in public places is one that we are still, I think we as a community are wrestling with what the right answer is on how to address that. And I think the challenge is that in many places, and this is a challenge that's going on in Nevada right now, they're in the process of creating indoor lounges for people to use. And so like, is there an outdoor use solution that isn't a public outdoor use solution before we give up indoor spaces? These are all the things that the public health community is wrestling with and trying to answer. And this is a place where we do not, I think, have we haven't coalesced around, and we don't have an answer yet. And I think there's going to be a lot of trial and error. So so Linda's question about New York State, I think NYS, she's saying New York State is what that means, with cannabis use in 21. I would work with your health department. I'd work with ANR and other partners to try to come up with an answer. I can maybe help, like reach out to me, and I can help follow up with you and help connect the dots. But this is absolutely something that CDC has been engaged in, and we do not have an answer yet with the partner community because we're not sure what the right answer is. And part of the challenge is we also need to quantify what the risk of exposure to cannabis use is as well, which we do not necessarily have as robust of data. It's sort of the same as Samantha pointed out earlier around aerosol. Like we're in the process of building the evidence on what the risk exposure levels are. Have there been laws proposed to have designated smoke-free areas for those choosing to use tobacco or marijuana products similar to bars? Yeah, that's happening in Nevada right now. I knew as soon as I said cannabis, this would turn into like a cannabis Q&A. That happens. And I think it's a challenge. So I think we've answered that throughout. I'm trying to work through these questions. Does the larger female exposure, this is for you, Samantha, I think, does the larger female exposure have a residential effect on prenatal exposure and maternal health with an increased risk of generational health and addiction? That's a great question.
That is a great question. We did not go
Wow.
that far in our analysis, obviously, because we were looking at youth. And honestly, I am not sure what the answer to that is, and I'm not sure if
We have,
anyone
but
has done something on
I mean,
that.
I think we have a lot of information on the risks of secondhand smoke exposure in general to prenatal health. We know that secondhand smoke exposure causes SIDS, for example, that it's a causal factor for SIDS. So we absolutely have some conclusions in the Surgeon General's report. I don't know if it's going to get. I mean, this is essentially an epigenetics question, I think, and I don't know that we have like an epigenetics answer for you. But we do have some information on gestational health and reproductive health among women who are exposed to secondhand smoke, and it's robust, and it's in both the 2006 Surgeon General's report and then the 20 it was whatever the 50th anniversary year was. I think that was 2014. So the 2014 report updates those findings, so we can make sure that we get those to you. But I'm not educated. I'm not educated enough to answer the epigenetics question. It's a great question. I hope that's not unsatisfying to you, Joy. I'm sorry. So here's a question from an anonymous attendee. What role do outdoor protection policies, such as smoke-free parks, have in places without indoor protections, right? So in the southeastern United States. Well, one is it can show community community support for the policies, right? So this has been something that's predominantly been done in places where maybe they can't adopt a smoke-free law. So we didn't talk about this, but there are some states that preempt local communities from adopting smoke-free laws or smoke-free laws that are stronger than the state law, which may have designated areas in it. And so smoke-free parks may be something that can be accomplished without a law, for example, right? Like maybe the Parks Department can do it through administrative rule, or other outdoor settings can be done in a way that it doesn't actually counter preemption, or it may be that there's a carve out for it or whatever. I think that's been some case in some other states. And so it's a place to sort of make progress where you can make progress is the way that I would describe it. I hope that sort of makes sense, but it's incremental progress, which isn't very satisfying in a lot of cases when we know what we know about the harms of secondhand smoke exposure. But if your hands are legally tied and you can't actually work on these policies because they can't be adopted at a statewide level, then that's a place where incremental policies can be adopted. And that's why tobacco-free campuses are another reason why, like, it seems to be that these locations can be a place where incremental progress can happen. And then another word about preemption is that preemption isn't like forever necessarily. So Tennessee, for example, just repealed preemption. So Tennessee had a law that didn't allow bars to adopt at the statewide level. So bars were exempted from the statewide law, and bars so a community couldn't go in and ban smoking in bars. They pulled out the legislature just removed the preemption for bars, and so now communities in Tennessee can adopt smoke-free bars, for example. So incremental progress is absolutely something that can be successful and can happen. So this is a question about the aerosol definition, Samantha. When you're talking about, from Aaron, when you're talking about aerosol, is that specific to vaping or does that include other items? So do you want to talk about the definition covered with aerosol in our study? Because I think there's the distinction of what the study says and then what we're saying. And so why don't we talk about the study first?
Yeah, I'm looking back at the question. So this question specifically for aerosol asks about vapor from someone who is using an e-cigarette. And so that is what we're asking, what the respondents were thinking when they answered the survey may be something different. So that is definitely a limitation to the study because we don't know exactly what the students interpreted that as when they were answering the question. And Michael, do you want to add anything onto that?
I don't, but I want to point out that we got a comment that PRAMS is another great resource to provide insight on maternal and infant health, and that there's tobacco components to the survey. So I had not thought, I mean, I was thinking about that, but not actually saying it. So I'm glad that that we got a comment on that because that's a great comment. And so we'll make sure to get some of the link to PRAMS when we get them to Jacqueline, and also there's a whole host of like findings like that in the literature as well. So I was just going back one, but I think your answer was fine. And I think, when we talk about aerosol, is that specific to vaping or does it include other items? I mean, I think we need to define what we're talking about, right? And so that's why definitions are so important in policies, right? And so if you don't define it, then the industry is going to define it for you.
I just want to point to a question because I know a lot of our coalitions work with youth specifically.
Okay.
So a question from Bianca. So what can youth do to advocate for their health and having a healthier environment? Um,
Yeah, so I mean, I would say that youth can be some of the strongest advocates that decision makers can hear from, right? Like, I mean, I think don't discount the ability of a youth group or a group of youth talking about their exposure experience, right? Like it doesn't need to just be people with PhDs and MDs who are talking to lawmakers and giving technical assistance during the rule or lawmaking process, right? Like youth advocacy groups can absolutely be a critical part of that. And in some cases, and I'm gonna like really like maybe get a little informal with you right now, like because some of the reasons why are because, and I've heard lawmakers say this, is those kids remind me of my grandkids, right? Like and that absolutely resonates with lawmakers and decision makers, right? When they have when you have 10 to 14-year-old kids or older, sure, like 10 to 17-year-old kids, right, or whatever, go to a youth group, to go with as their youth group or their Girl Scout group or their Boy Scout group or their whatever like group that's meeting, like come and talk to them about, this is our exposure experience in our school, or these are the products that we collected safely, that we collected like on our school grounds, or these are the products that we collected in the park or on the beach. Like that can be a really, really powerful like experience, and is actually it's a real grounding experience, because the alternative is you're going to have businesses that no matter what evidence we have, and we have very strong evidence that comprehensive smoke-free laws do not harm businesses, right? This is in the Surgeon General's report. Like there are numerous studies that restaurants and bars are not harmed, right? Like that they, in fact, in many they either neutral or they see positive receipt results. Like no matter what, they will still show up in many cases and say, like, this is going to put me out of business. Like you're gonna harm my livelihood. Like countering that with kids showing up and telling their personal experience can be really powerful. So Samantha, I don't know if you want to add anything to that. Like, but what these data show is just that those kids are out there having those experiences. I hope that answered the question, Jacqueline.
yeah, no, I think that's great. I see a few more questions that have come in. We have like 5 more minutes. There's a question from Lacey at the bottom about investigating the first age of exposure and relationship to the likelihood of
Um,
initiation.
Yeah,
Unfortunately, I don't know off the top of my head
we can get that.
what
Yeah.
that relationship is. Yeah, I can look into it and send some resources on that particular question.
And then I want to point out that Cynthia has a great comment, and I should have, when we were asked earlier, I should have said like I shouldn't have only said A&R. I should have also said groups like the Public Health Law Center in St. Paul, Minnesota. They are also like a key partner in helping not only with model laws but with development, right? Like they're a technical assistance provider who who we work with directly at CDC all the time, and so the Public Health Law Center will make sure that we include them. They're absolutely legal experts who can not only help your health department or your nonprofit group, but they can also be a liaison to city and county attorneys, and sometimes lawyers want to talk to lawyers, right? And so they're not your lawyer, but they can they can talk the way lawyers talk, and so that they're absolutely a resource as well that could be helpful.
Great. Are we missing any questions? I feel like we covered a lot of them.
Yeah, and so we just gotten some comments, and I'm not sure everybody can see the chat. And so, like, someone commented that in Arkansas, a high school youth coalition educated the city council several times. The city of Harrison then passed Tobacco 21. The Arkansas governor heard about it, invited the group to Little Rock to be there when he signed the Tobacco 21 law into law. So that's T21. That's not smoke free, but I think that's a good example of the role that youth advocates can play. I think we've got to be careful, though. I think I'm going to be mindful from putting on my CDC policy hat that federal resources can't be used for lobbying, right? Like, and so CDC's resources can't be used. Like, it's about educating people about the science, right? Like talking about the evidence. Advocates advocate. Like we, people who get CDC resources or CDC funds or that are funded by that can't be engaged in lobbying activities, but that doesn't mean that you can't be engaged in the process to talk about what we know works. So, and I'm happy to talk about that more if folks have questions later. Not lobbying, just educating. Exactly. I didn't think that's what you said was the comment that we got. So exactly.
Okay. I feel like we covered all the questions. Oh wait, we got another one. Let's see. This one from Aaron at the bottom. I don't know if you all can see that.
Yeah, with the change in the way society looks at tobacco use, the limitation of promoting tobacco, ensure it isn't directed to youth, education of health issues associated with tobacco, what remaining factors are potentially encouraging youth to become susceptible to tobacco use? I mean, the tobacco industry still are a player out there, right? Like I think there is still tobacco industry marketing that is targeted to youth. There are flavored tobacco products that are absolutely appealing to youth, and there are menthol cigarettes that are absolutely appealing to youth. There are flavors like nicotine levels in like nicotine salts being in products that make it more palatable and easy for youth to start on these products. So there are absolutely product design and product sales that as many of you hopefully know, like the Food and Drug Administration has proposed addressing flavored cigars, menthol cigarettes, right? So there are opportunities to close the gap, but that's where communities like can absolutely continue to work on that. Like there are communities that have closed the gap on combustible products as well as electronic products, and that work absolutely needs to and can continue. Samantha, I don't know if this was sort of like this is in our discussion, sort of, right?
Yeah, well, and then also related to marketing, beyond flavors, there's also just how the products look and new products that are being put on the market. So there are heated tobacco products that are kind of a re-entry to US markets, and some of them are marketed in a way to make them seem like the new shiny technology with these stores that pop up that look kind of like Apple stores, and there's just so many different ways that these products are marketed towards youth to have to consider.
Great.
Great. Well, I want to be respectful of everyone's time, and we're right at 2 o'clock. So thank you so much, Dr. Puvanesarajah and Mr. Tynan, for your wonderful, comprehensive presentation. I know we had a really great Q&A, and you have shared with us some resources that I'll be distributing. And just a reminder to everyone still on the webinar that I will be sending out an evaluation email from which you can download your letter of attendance, and that will include links to the recording, the slides, extra materials, etc. So look out for that in the next day or so. And thank you again, and I hope everyone has a great afternoon.